I know you can't talk specifics, but leading on from that, has there been any, I guess, cases or patients that stick with you for various reasons, whether because they've been exceptionally either brutal or, if they're, even if they were a patient that treated, turned because you treated them really well. Is there any particular cases that you remember for any reason?
Yeah, absolutely. Unfortunately, just go on that point that you asked in the question, because they've done particularly well. Unfortunately, it's a bit of a thankless job. And the reason I say that is because patients are the patients we see are the most damaged. They take the longest to rehabilitate. And in a slight irony, once they get well enough to no longer need forensics, they move on to another service. So we don't even see them get better. We see them get better to the point of discharge, but not beyond that. So if somebody's deemed to who has been violent in the past, could have been a high level of violence, could have even been like murder, if they're deemed to have been stable in the community for whatever 6 months, a year, then they're discharged to the general adult service. And if they're even more stable, they're eventually discharged to their GP. So I suppose the point I'm trying to make is we never actually see them at the other end when they come out well. Unfortunately, that's just the kind of a quirk of the job. But to answer your question, the one that definitely stands out the most to me, and I've actually written a book about my professional memoirs, quick plug there. It's called In Two Minds, and I talk about her extensively, is a girl who in the book I call Yasmin. That's not her real name. And she was 18 years old, and she didn't have any kind of history of psychosis, no antisocial behavior at all, never got into trouble at school. She was like a model patient. In fact, she was going to be a medical student. She'd applied to do medicine. And over the space of a couple of weeks, she suddenly became psychotic, and she smothered and killed her nephew, so her 3-year-old nephew, just completely unexpected. She believed that he had demons inside of him, and that she was rescuing him, saving his life by getting rid of these demons, and that she could reincarnate him later on that evening with the full moon. And as a reflection of her odd belief, she didn't even try and cover it up. So she just went around her normal day. So she was babysitting this kid, and then her mum, so the kid's grandmother came, and obviously, got really agitated. And Yasmin, this girl, didn't understand. So in her mind, she was like, I don't understand why you're shouting. I'm going to reincarnate him. Again, I'm just saying this because it really reflects that she wasn't like an evil, hostile, antisocial person that wanted to harm this baby. She didn't understand what she'd done. So she got remanded to Holloway Prison, which is now defunct, but I assessed her there. And I was a registrar at the time. One of my first cases, as the first time I gave evidence at the Old Bailey. And it was really hard to assess her because she was very guarded. She wouldn't talk about what happened at all. And she would just make these really weird, slightly religious kind of things like God will understand and things like that. So she wouldn't address any of the symptoms, but she made vague statements that made me question her mental state. So upon my evidence, she went to hospital on a remand order, section 48, instead of being charged for a life sentence, which is what the prosecution wanted. And she got treated over many years in this medium secure unit. I worked there for a time, then I had to move on with my other placements. And it took a long time to treat her. And it took about 18 months before she even accepted what she did. So for 18 months, despite all these medications we were giving her, she remained psychotic. So she didn't believe what she'd done. She didn't believe that she killed this boy. She believed that he'd been reincarnated. And then, as you'd expect, 18 months later, when finally her psychosis resolved, she had this like huge wave, this tsunami of guilt, which we also had to treat. So I suppose to me, it stands out for so many reasons. I mean, the most obvious reason is just the tragic nature of it all. It was very, very scary for me to give evidence at the Old Bailey in a criminal trial. I'm very used to it now because I've done it dozens of times since then, but that was my very first time. And just this kind of tragedy of it all, seeing her deal with the aftermath of it. And then the other bit I forgot to mention was that her brother, so the father of this child, would come in on a weekly basis, not near the beginning, but towards the end. And I would be in the room when we were doing this like family therapy to try and heal like their relationship, and he had to forgive her basically. And it was just really painful to watch the whole thing.
There's a few interesting points. I guess one is in the murder case specifically, people may be aware, especially if they haven't got a true condition, that if I cite, psychosis or schizophrenia or hearing voices telling me to do it, they can almost get off the hook for a life sentence, for example. So obviously your assessment in that is crucial, right? It's life changing. It's essentially almost sending someone to life in prison or a rehab kind of placement. And going back to when you were saying psychopaths can be very manipulative and, to say things they get they want, how do you even start? Where do you start with that? With such heavy, where the outcome is so severe potentially if you get it wrong.
Yeah. So that's a very good question. I suppose I would say that the threshold to get a psychiatric defense and to go to these units like Yasmin like that story, the threshold's really high. So you can't just have some symptoms of mental illness. You have to, upon the evidence of a forensic psychiatrist such as myself, you have to prove, like, there has to be an established mental illness, and you have to prove that they were suffering from symptoms at that time. So Yasmin's case, for example, there were lots of witness statements about her behavior in the weeks leading up to this, and she made lots of bizarre statements. Her neighbors had very strange conversations with her, which didn't make sense. Even at the police station, she was doing she was saying some really strange things. Even on the psychiatric ward, there were other kind of strange things about her, like she wet herself at one point and then didn't tell anybody while she was in the police station. So I suppose what I'm saying is you don't just take the person's word for it. You look at all of the evidence, you look at all of their background, you look at psychiatric reports, especially for a murder case. You're expected to go through these things with a fine-tooth comb. So you need to seek some consistency, not just how they were at the time of the offence, but the police interview transcripts, CCTV footage, any witness statements. That's one thing I'd say. The other thing I'd say is that it's actually really easy to spot somebody, I think, who's faking it, because they're just not very good at it. So I'm sure you, in your line as GP, you must have met some psychotic patients in the past. And those who are truly psychotic are very guarded, right? So if somebody comes in saying, I'm hearing voices, doctor, or looks around, like if they're overacting, then I'm really suspicious. Doesn't mean automatically that they're faking it, but I'm very suspicious. If they try and convince me, if they have an agenda that they want to get into hospital, then I'm very suspicious. People who are truly psychotic, from my experience, which is very, very small proportions, probably 1 to 5% of the cases I see is very, very small proportion. They're very guarded, and they don't want to talk to you, because if they're paranoid, they're not going to just open up to some chump in a waistcoat they've never met before. They're actually, they see me as part of the system. So it's the ones that don't tell me anything. And if you chip away, then you finally get some psychotic beliefs. Those are the ones that are truly psychotic. Whereas the ones that overact are like, dribbling wrecks that are looking around and going, they look like what Hollywood would make a mentally ill person look like, not what a real mentally ill person looks like.
That's interesting. I guess that's from experience as well, but also it's interesting about saying gathering evidence, because I was already under the impression if someone says I was hearing voices, how can you prove that? But I guess all those witness statements you're saying, looking at the whole picture, because otherwise it'd be too easy for someone to say that, right?
Yeah. And then for the small proportion of cases when you're not sure, you can use a remand order, which is what happened with Yasmin, because even though I thought she was ill, it was really hard to actually get her to tell us what she was thinking. So it's hard to like have anything solid or tangible that was a psychotic belief. So she's a perfect example. So you can have a remand order, which lasts 3 months initially, and then you can add a month onto it, and the trial gets delayed by a month for a maximum of a year. So in those very small cases where you're not sure, you can actually observe somebody on a nursing in one of these units before their trial. And it's relatively easy, I would say, to try and fake hearing voices for an hour when you're speaking to a psychiatrist, but it's pretty hard, I'd say, to do that for an entire year if you're in a psychiatric unit. And are there people that fall through the gap? Not to my knowledge, but it's not unfeasible that there are. But also the other thing that's really important to remember is that psychiatric admissions are not necessarily shorter than the equivalent prison sentence. And in fact, if somebody's chronically mentally unwell, there's been cases that I've been involved in where they're longer. So you actually end up staying in the psychiatric unit for longer than you would have as an equivalent prison sentence.